Administration has joined the world to commemorate World AIDS Day 2024 with a strong message of hope and determination to protect children from scourge of HIV/AIDS. The mandate Secretary Health Service and Environmental Secretariat Adedolapo Fasawe says the FCT has made a great progress in keeping people connected, which has helped to reduce the number of those who stop treatment to less than 2%, in addition to improving access to HIV service with 122 health centers, which is even the most remote communities.
Working towards eradicating child HIV by the year 2030, which is the global standard. So I think we are on the right path. And with collaboration with all the stakeholders, the partners, we are sure that that target will be realized in the FCT.
We should also know is behavioral change. People who are involved in risky behaviors should know that there are preventive measures they can take to prevent themselves from contracting this disease. And it is good for everyone to know their status. Gone are the days where people thought that HIV is a death sentence, but if you know your status, you can access care which is free of.
And joining me live is the National Clinical Mentor in the National AIDS and STDs Control Program in the Federal Capital Territory, Dr. Chachi Ekere. Did I pronounce it well?
Yes.
I did?
Yes,
Thank you very much. Yes, okay, let's look at, take the rights to part, sustain the HIV response and stop HIV among children to end AIDS in Nigeria by 2020 is the theme for this year's celebration. How do you think the response as a country has been so far in this manner?
Okay, thank you. Response for the country so far has been really good. Because if we track back to the early 2000s when we started with the HIV scourge pandemic in Nigeria, Nigeria has made very significant progress in placing a lot of, first of all, finding a lot of people who are HIV positive so that people know their status. And the estimate as of then was about 1.9 million individuals. And currently we have just approximately 1.7 individuals already on antiretroviral therapy, which is the medications that helps them stay on treatment, get virally suppressed so that the risk of transmission to others does not occur. So yes, Nigeria has made very significant progress in that aspect, and even here in the FCT, because there is a benchmark, the UNAIDS 95-95-95, that looks into each aspect of that. So the first 95 is looking at those who know their HIV status. The second is looking at those who know their HIV status that are now on treatment, while the third is then looking at those on treatment who have achieved viral suppression, meaning those people can't transmit the infection to other people. So that's where we say U equals to U, undetectable is equal to untransmittable. So for the HIV program in the FCT and the nation at large, looking at how to stop the HIV spread, especially for pediatrics, because we found out that yes, we have a lot of the adults in care, men and women, but for children, like for example, Nigeria accounted for about 25% of the global numbers for new infections in children. So that's what we're trying to reduce, making sure that women of reproductive age do not get HIV infection by the preventive strategies, and then those that are already HIV positive do not transmit the infection to their babies.
If you look at the statistics, it says that 38% of the HIV disease around West Africa, Nigeria has that huge number. And if you start breaking it down, you know, children are also part of it. So the FCT is saying that is going to be able to protect children from that HIV epidemic. But how do the FCT plan to do this so that we don't have a situation whereby children are also now because it's becoming an epidemic, so to say.
Okay. So when you look at the numbers in general, Nigeria is over 200 million people. So when you compare that to the rest of West Africa were the most populous. So when you actually see in the contribution numbers, that's why we have that proportion.
38%.
Yes.
Man, that's a lot.
That's a lot. But then in looking into how do we prevent it, basically. So there are different strategies which in the FCT we are currently running. So we have what we call a mother-to-mother program that focuses on mentor mothers. Mentor mothers are ART experienced women living with HIV who have we call them ART experience, antiretroviral therapy experience, in that they are been on ART for a while, they are virally suppressed, and they have a track record of showing that they have HIV negative children. So these mothers help other mothers that just found out they are positive to walk through that cascade to ensure, okay, now you know your status, now this is the time for you to stay on your medications, so you're virally suppressed so that you don't transmit this to the child. And then there's an 18-month window period, which we call a PMTCT final outcome. That's the prevention of mother-to-child transmission of HIV final outcome. So that 18-month period, there is a cascade of activities, of tests that have to be done, and prophylaxis that has to be given to the babies to prevent that. So these mentor mothers help hold those mothers hand in hand throughout that course to ensure that that doesn't happen. And then also in the FCT, the Mandate Secretary for Health has also made it very clear that health insurance services for the PMTCT clients are entirely free across facilities. So that's a given. So there is no barrier for finance to accessing care for the PMTCT clients as well. And then also for their babies. Every child that is born to also has that package. She made that announcement in one of the meetings. And then also we have other programs where we liaise with traditional birth attendants across facilities to ensure that, yes, at that level, if a woman fails to get to the primary healthcare center, someone can link her up, can do the testing there, find out she's positive, link her up to a facility to ensure that she starts treatment.
While we just round up this segment, how do we stop the stigmatization? Because it was...
Okay, yeah, so stigma has two parts.
Okay.
So there's self-stigma, and then there's stigma that comes, the external stigma that can come from either workplace, family, colleagues, and friends. Yeah. So stigma is one of the most crucial factors and can be stopped mainly where you have individuals have enough information, because you'll be shocked that in Nigeria, you go into some communities and you ask the question, do you think HIV is real? And some people look at you and smile. Like during the press briefing last week, Monday, someone asked the question that one of the news outlets actually said that they went into communities and were asking people, why don't you want to know your status? They said they don't need to because it doesn't. So already, how do you ask someone in the community about their status and they're already scared and telling you, no, they don't need to? Is it an issue of knowledge? So yes, we provide that knowledge across, all our facilities. It's all they are given. And then not just the knowledge of HIV, but there is prevention. We have the pre-exposure prophylaxis. We have the post-exposure prophylaxis. So if you have any incident or exposure, you can take those medications within 28 days, it stops that. But then the pre-exposure prophylaxis, many people link it up with being promiscuous, having promiscuous, risky behaviors. However, that information has to go out that, yes, preventive methods are cross-board. They are available. So that not just in testing. When we test you and you're negative, yes, these are the ways to stay negative. And then when we test you and you're positive, stay on treatment so you don't transmit to your children, other partners, and then HIV is not a death sentence.
Thank you so much. We really appreciate it. Thank you, Mr. Janche. Now we'll go to sport. The ongoing polo tournament in Abuja